We've all done it, right? Skipped brushing our teeth for a night, maybe two. But have you ever really wondered what would happen if you just stopped? For good? Okay, let's get into it because trust me, the consequences go way, way beyond just a little bad breath. So, yeah, let's really explore that question. What happens in the hours, the days, and even the years after you hang up that toothbrush for the very last time? Well, the answer, it's pretty wild. We're talking about a full-on bacterial takeover, a civil war that's fought by your own body, and some seriously shocking effects on your overall health.
All right, so the main players in this whole drama are the hundreds, literally hundreds, of species of bacteria that are already living inside your mouth. You can think of them as your roommates. You didn't choose them, but they're there. And one of the most notable is a little guy called Streptococcus mutans. For our story, we'll just call him Strep.
Now, Strep and his buddies, they have a feast every single time you do. They absolutely love the sugars and proteins from your food. And after they're done eating, well, they leave a mess. They excrete this slimy, sticky substance that coats your teeth. The fancy science term is biofilm, but you and I know it as plaque. It's basically a bacterial pigsty, and it's forming in your mouth right now.
Now, look, a little bit of plaque isn't the end of the world if you're brushing it away regularly. But when you stop, oh boy, that's when that soft, slimy film begins a rapid and pretty dangerous transformation into something much, much tougher.
So how does this hardening actually happen? Well, first, the plaque that isn't removed just keeps building up, getting thicker and thicker, especially right along your gum line. Then the minerals in your own saliva, things like calcium, start to work their way into it. They basically calcify the plaque, turning that soft film into a hard, rough crust called tartar or calculus.
And get this isn't a slow process. It happens incredibly fast. Plaque can start to harden in as little as 24 hours. And within just 1 to 3 days, bam, it can fully form into tartar that's literally cemented to your teeth. At that point, no amount of brushing at home is going to get it off. And this really spells out the key difference, doesn't it? Plaque is that soft gunk you can manage yourself. But tartar? Tartar is a whole different beast. It's a calcified fortress for bacteria. It's rough, usually yellow or brown, and it acts like a protective shield for even more bacteria to grow right up against your gums. And yep, only a dental professional can break that fortress down.
So with this fortress of tartar all set up, the situation escalates, big time. The bacterial colonies start releasing all these toxins, and your body declares war. But here's the crazy twist. Your body's own defense system is about to start causing some serious collateral damage. The first stage of this war is called gingivitis. Your immune system triggers inflammation to fight the bacteria that are trapped by the tartar. This is exactly why your gums get red, swollen, and tender, and why they might bleed when you eat. It's literally your body trying to fight off the infection.
But here's the paradox. In sending all those fighter cells to battle the bacteria, your immune system creates a hostile environment. And while that's bad for the bacteria, it's also really destructive to you. The very attack that's meant to protect you starts to damage the healthy gum tissue, and even more critically, the bone that's holding your teeth in place. If this goes unchecked, it builds into something much worse, periodontitis. As the supporting tissue and bone get destroyed, your gums actually pull away from your teeth, and that forms these deep pockets. And these pockets, they become the perfect breeding grounds for even more bacteria. The infection gets deeper, the bone continues to die off, and eventually, your teeth get loose and can just fall out. And believe it or not, the story doesn't end with tooth loss. When your gums are this inflamed and infected, they become a gateway, an open door for all those harmful bacteria to get into your bloodstream and travel throughout your entire body, leading to some really serious health issues. And if you think losing all your teeth sounds extreme, consider this. About 10% of Americans between 50 and 64 have already lost every single one of their teeth, and it's often because of this exact process. So once those oral bacteria get into your bloodstream, they can just wreak havoc. One study found that people with periodontal disease were a staggering 4.5 times more likely to suffer from chronic kidney disease. And the connection to brain health is just as alarming. Another study found that people who didn't brush their teeth every day had up to a 65% greater risk of developing dementia. It just goes to show you how what happens in your mouth really doesn't stay in your mouth. And the list of risks keeps going. That chronic inflammation and the bacteria from gum disease are also linked to an increased risk of heart attacks, complications with diabetes, and even certain types of cancer, like pancreatic, esophageal, and colon cancer.
Okay, I know, that was a lot of doom and gloom. But here's the most important part of this whole story. It's how incredibly simple it is to prevent this entire cascade of events from ever starting in the first place.
And this is your entire defense strategy right here. All it really takes is about 4 minutes a day. You brush for 2 minutes twice a day and floss once a day. That's enough to disrupt the plaque before it ever has a chance to harden. Add in a professional cleaning every 6 months, and you're set.
And let's just lock in this crucial point. Remember that timeline we talked about. Once that 72-hour window closes and plaque hardens into tartar, your toothbrush is useless against it. The only way to remove that hardened deposit and break the cycle is with a professional cleaning or scaling.
So, when you think about brushing your teeth, don't just think about having a clean smile. Think about protecting your kidneys, your heart, and your brain. Your mouth truly is the gateway to your body's health. So the real question is, are you guarding that gate?